Welcome to Bayou Health, Who's In and Who's Out. All information presented here is up to date as of March 1st, 2016. It is important to remember service systems are continually changing, and it may be necessary to verify information presented here. You may also contact phone numbers given in the presentation for questions or additional assistance. This presentation is funded through the Louisiana Department of Health and Hospitals and developed by myself, Karen Scallon, Certified Parent Support Provider, through Special Needs and Parent Support Services of LA, LLC. You may reach me at any of the contact information listed here. Phone 504-430-3604. Email kcscallon@gmail.com. Twitter and Facebook at Karen Scallon. For any questions regarding enrollment or services under any Bayou Health plan, MCNA dental services for children, or Magellan services, do not hesitate to call the helpline for individuals and families of children and youth with special healthcare needs and disabilities. You can reach the helpline at 504-300-5117. Let's get started. First, we'll talk about which populations are now mandatory participants in Bayou Health. As of December 1st, 2015, children with SSI benefits are now considered mandatory participants in Bayou Health for all of their health care, behavioral health, and non-emergency medical transportation needs. Also, as of December 1st, 2015, Children and Family Opportunity Act Medicaid are now mandatory participants in Bayou Health for all of their health care, behavioral health, and non-emergency medical transportation. Family Opportunity Act is a Medicaid buy-in program for children with disabilities and special health care needs. As of December 1st, children using the Children's Special Health Services clinics around the state are now considered mandatory participants in Bayou Health for all of their health care, behavioral health, and non-emergency medical transportation needs. All Medicaid recipients are mandatory participants in Bayou Health for their specialized behavioral health and non-emergency medical transportation. There are no exceptions to this mandatory enrollment. Specialized behavioral health includes psychiatric care, psychological services, and addictive disorder services. Now let's talk about optional participants in Bayou Health. There are only two exceptions to mandatory participation in Bayou Health for healthcare. The first are children considered Chisholm Class members. Chisholm Class members are children with Medicaid who are also on the waiting list for Medicaid waiver services through the Office for Citizens with Developmental Disabilities. Children who are already Medicaid eligible and who are on the waiver waiting list, also called the Registry or RFSR, are mandatory participants in Bayou Health for specialized behavioral health services and non-emergency medical transportation. They may opt into Bayou Health for health care and opt out if they choose to. The decision to opt in is made by the parent. They are not enrolled first and then have to opt out, as other groups have had to in the past. There have been a few complications with Chisholm Class members trying to opt out of Bayou Health. There may be some confusion if they were lost on the registry or for some reason were not identified as being on the waiting list. It's important to remember that these questions can be researched and corrected. Some examples of circumstances that caused children to be listed as mandatory participants in Bayou Health, despite parent reports of being on the waiting list, include parents who had not followed through with eligibility review at age 3 and the child was not officially placed on the list, parents who had the child on the list but moved and did not report a new address in a new region where they live, and any other issue that could have occurred during the stages and steps needed to occur to be on the registry. If you think your child is or should be on the registry waiting list and Bayou Health indicates they are a mandatory population group, call the Bayou Health helpline at 504-300-5117. We'll gather information and have it researched with our partners at Department of Health and Hospitals. The second exception to the mandatory participation rule for healthcare services are individuals who receive developmental disability waiver services. Developmental disability waiver services are extra services provided to qualifying individuals with developmental disabilities for supports needed to remain in their community and not have to go into institutional care. These waiver services include the Now or New Opportunities Waiver, Residential Opportunities Waiver, or ROW, Children's Choice for children under the age of 19, and the Supports Waiver. Individuals in these programs are only mandatory participants in specialized behavioral health and non-emergency medical transportation services offered by Bayou Health. For their health care, they can opt into Bayou Health and at any time may opt out as they choose. Individuals who opt in or out of Bayou Health should also be aware that it may take a few days to become effective. They should always ask for the official date when services will transfer. As always, if you have any questions or would like additional information, please contact the helpline number at 504-300-5117. Thank you for watching the Bayou Health Helpline channel on YouTube.